one of the mysteries of modern times is how much the burden of mental illness is increasing in society after society. So depression, for example, which 50 years ago was not a real big problem in society, is today the second leading cause of disability in the country. So, in the world, excuse me. So why is that? And there can be many explanations for that. But I think there are it could have to do with our food that we have, stressful lives, we're not as close to families. There's a lot of possible explanations, and I think there are indeed a lot of factors. But it's also, we live in a corporate world where psychiatry and the pharmaceutical industry likes to get us to think of ourselves as depressed, because then they can sell us a product, an antidepressant. So part of what we're seeing is a corporate worldview being promoted to us that gets us to think we're depressed, even though we may not really be depressed, and to get to take drugs. So partially what you're seeing, I think, is a sort of a philosophy that has been promoted to people. But by the way, it's a philosophy that tells you you're supposed to be happy all the time, which is complete nonsense. Anybody who knows literature and history knows it's nonsense. So part of what's happening is a false sense of being is being promoted, where you're supposed to be happy all the time, and then if you're not, you say, I'm depressed. And then once you're depressed, maybe you stop working as much and you need to take pills. So there's a lot of things. There are real factors, I believe, related to food, stress, working type situations, less family. But it's also that depression has been sold to us, so to speak. A market for antidepressants has been created. Well, 30 years ago, it might have been many different ways, including a lot of sort of social ways or psychotherapeutic ways, particularly outside the United States. But increasingly what has happened is the pharmaceutical industry, in concert with the American Psychiatric Association, has really promoted a first-line therapy of treatment with the use of medications for disorders of all types, depression, ADHD now is being globalized, certainly psychotic disorders, even anxiety disorders. So increasingly, whereas it used to be like Asian countries treated these different distresses differently than, say, Western countries, there's been a real globalization and a uniformity, sort of in a bad way, a unifying of same approaches in country after country. But that speaks to the power of the pharmaceutical industry to export a form of care that, in fact, may not be very effective. But increasingly what we're seeing is psychiatric medications worldwide as a first-line therapy for psychiatric problems of all sorts. So one of the questions today is, first in the United States, but increasingly in many societies, we've really embraced the use of psychiatric drugs. And we've embraced the idea that psychiatric disorders are sort of biological disorders, brain disorders, and that's why you need a pill to treat that brain disorder. Well, on a big scale, what you've seen is as society after society has adopted this form of belief and has adopted drugs as a central response to psychiatric distress, the burden of illness, or the burden of mental illness in those societies, the burden of depression, the burden of anxiety, the burden of disabling mental illnesses, it hasn't gone down, it's gone way up. So what that is telling us is that this way of responding to psychiatric distress and this whole view of humanity and what it means to be alive and how he responds in difficult moments is this corporate response, this drug-centered response is not working. We need to do something differently. And we've been doing this for 30 years. In the United States, basically since 1980. In other societies, maybe more since the mid-1990s, and it hasn't worked. We just see the burden of mental illness increasing, so let's do something different. So in every where you see this, so if we look at data, and we look at individual data in terms of the number of people disabled by mental illness in different societies, in the United States it's increased about fourfold since 1987. Australia, fourfold. New Zealand, fourfold. But you're seeing it in Scandinavian countries, European countries, etc. So that's one measure, okay? People who can't work and need government care because they're disabled by mental illness. But then you also see World Health Organization data that they have something called life years lost to disability. It's basically unable to work, etc. That's soaring across the globe as well. So why? Why are we seeing this? Again, I think we need a big picture sort of analysis of this. But I do think it has to do with such things as food. We do eat a lot of processed food, with very different diets than we had 50 years ago. We may be getting a lot less exercise than we used to 50 years ago. People everywhere now are tied to their computers. It's not just a Western phenomenon. So I think that's a problem. I think that's not good. It is harder in many countries because of mobility. People are separated from families in ways they weren't. I think that oftentimes a lot of stress. And then one of the things I've written about in Anatomy of an Epidemic is that in fact, psychiatric medications, there's good evidence that they increase the chronicity of these disorders. So whereas in the past, a lot of these psychiatric disorders were episodic in kind. You were sort of in difficult situation or had a depressive episode for a time, then it lifted. These were seen as episodic problems so much. The drugs and this conception of the disorders tends to make them run a much more chronic course. That's one problem. And two, you do see a significant number of percentage of people who will go on, say, an antidepressant for a mild problem. They're undergoing a divorce or losing a job. They're in a situation that in the past would have passed, and they would have gotten better. Not only do they become more chronically ill, they'll sometimes move to a more severe illness. So you'll see people moving from depression to bipolar illness. And it's understood that, in fact, antidepressants can stir mania. So you can have side effects that take a person with a milder disorder and move them into a more severe category. And the key thing here on this is this. If you look what's driving disability numbers worldwide, it's not psychotic disorders, it's the affective disorder. One, depression, such a much bigger problem than before. And manic depressive illness, which we call bipolar today, used to be a very rare disorder. The prevalence would be maybe 1 in 5,000 people would have a manic depressive episode each year. In the United States, it's now 1 in 50. So that's a 1,000-fold increase in the prevalence of bipolar disorder compared to 40, 50 years ago. And clearly, if you look at people who end up in that camp of bipolar, so often they've been exposed to other drugs before they got that diagnosis. One of the things that we also need to investigate with this new drug-based paradigm of care is what sort of message is given to a person when they come into a doctor and they say, I'm depressed or they're anxious, and the doctor says, well, here, you need a pill, and it's because you have something biologically wrong with your brain. Well, that's a very disempowering message. It's also one that removes hope, and it also says to you, you can't do much about this other than take this pill. Now let's go back through history. Let's go back what novels tell us, and even religious texts tell us. They tell us that, in fact, human beings are quite resilient. And yes, we can have very difficult moments. We can fall into depression, or we can have our anxious times, or even worse. But one of the things about being human beings is we can make changes in our life. We can change diet, we can change our social situations, etc. And what that tells us is we have this capacity to change our lives in ways that can lead to a better place. Sometimes it's difficult, sometimes it takes time, sometimes it's painful, but that's what history tells us, that's what literature tells us, and that message is lost in the current medical model of approaches to psychiatric distress and disorders. One of the ironies of the use of antidepressants, for example, is they're pitched to the public as fixing an abnormality, fixing a chemical imbalance in the brain. If you actually look at the science, we don't know what is going wrong biologically when people are depressed. The idea that it's due to low serotonin, in effect, has now been discredited. But the irony is once you go on a medication, an antidepressant, which theoretically increases serotonergic levels, your brain will respond, try to compensate for the presence of the drug, and it will now actually go into a sub-serotonergic state. You'll end up with fewer receptors for serotonin, for example. Now, the best evidence sort of shows that compensatory adaptation actually may make you more biologically prone to depression over the long term. So that's one possible effect, downstream effect of having your brain changed by these drugs. Now, in addition, these drugs sometimes can be sort of agitating drugs, and somehow in that agitating effect of the drugs, you do see people have a manic episode. I don't think we understand why that is so biologically, but it's a clear risk. There's different data on it, but in some evidence shows that about 7% of people who go on an antidepressant for depression will have a manic episode within the course of 12 months on an SSRI. With children, youth, 13, 14, it can be as high as like 13%, 14% of all children placed on an antidepressant will have a manic episode within the course of a year or two. This is a big question as we've become an urbanized culture, moved out of the rural communities, or more people moving out of rural communities into big cities. Does that increase the risk of becoming mentally ill? I honestly don't know the answer to that. I do think that being estranged from nature is bad. I think nature is a healing thing. I think being able to walk in mountains or by the sea or even in parks is a very good thing. I'm pretty sure you could show that daily walks of that sort are good for hypertension and are good for a lot of things. But sometimes I think, for example, in America today, our rural communities are collapsing economically. And so people still in those rural communities, you're seeing extraordinary amounts of stress in, say, white communities, rural white communities in the United States. And in some ways, I think sometimes cities today, as they've been revitalized, the inner cities have been revitalized, and people live there and find, restaurants and communities, that sometimes that can be very healthy. So I don't think there is a simple cities are bad, more stressful than rural life equation to be made. I think it's, if a city is healthy with parks and all, it can be a very healthy place to live. So of course many people watch a lot of TV. We're very attuned to the news today. And what makes news, of course, are bad events so often, tragic events, violent events. Now, I think there's no question that people who watch the news a lot and see this, they have an unrealistic understanding of risk. By that I mean they think the world's a much more dangerous place for them personally than it really is. So you'll see like an airplane go down, or maybe you'll see a school shooting, which are horrible. But when you ask people how likely it is to happen to them, they overstate the risk by many, many degrees of magnitude. I don't know, though, if that translates into depression. It might translate into sort of a sense that the world is a risky place, a fearful place. But does it translate into depression? I just don't know. It could, but I don't know. There's no question that obesity is related to a lot of psychological problems. By that I mean people who are obese and in bad health do not have good sort of mental, they're certainly at a lot of higher risk for depression and other sort of psychological problems. And think about it, we don't have a body over here and a mind over here and never shall the twain meet. Obviously the mind they're connected. So a healthy body is going to be much more likely to lead to a healthy mind. Conversely, an unhealthy body, someone who's obese and out of shape, etc., which means they're going to have less aerobic capacity, all that sort of thing. Of course that's going to lend itself to depression and other sort of mental problems. We do know that what we eat today, especially people who have processed diets, is so far away from, like, if you were eating like foods that were grown in the ground and you were picking them from your garden 50 years ago. It's just, we're so, in terms of their nutrient levels, so if we start eating a processed food diet, we know we're getting a lot of sugar and a lot of crap, etc. So clearly diet can be a big problem as to why we're not as mentally well as we might be. Now, I haven't studied it at all. I've read a little bit about the benefits of plant-based diets and getting rid of your meat, and I certainly am trying to eat a lot less red meat and a lot less meat as a whole. So all I would say is this: should we, as a population, be thinking about what we eat as a path to a better and healthier population? Absolutely. Whether the answer is in a total plant-based diet or a heavy plant diet, and how that can be mixed with fruit, and whether meat should be eliminated or just reduced, I don't know the answer to that. But I'm quite sure that a healthy diet is absolutely essential to sort of a healthy mind and a healthy population. And I think in general our food supply has a lot of problems with it today. Yeah, the fact that today we have this prescribing of antidepressants for people who are just struggling with setbacks in life, again, it might be divorces, it might be a breakup with a loved one, it might even be all the many ways that life throws us difficulties. And what has happened, at least in the United States, but increasingly in other countries, the pharmaceutical companies have promoted the notion that A, such things are abnormal to be struggling in this way, and B, we have an answer for it, and just take this pill. Now, that's false in two ways. One, it's not abnormal. This is what being alive is like. We struggle with our minds. Life is a difficult business. Growing up is a difficult business. And anybody who's read any literature, knows this to be so. The idea that it's not true is can only be promoted by people who've never read a novel. I mean, it's ludicrous. And then the other thing that's completely missing from this is, well, there's the second falsehood, is that the pill will solve things. We know that's not true. Because in fact, what you have to do is resolve the situation in your life that's so difficult. And then the third thing that is missing from that sort of new idea that's promoted by corporate interest to sell pills and doctors get lazy and do it, is sometimes we need to go through difficult times. There's something that you learn from that. You gain greater resilience, and then you do make changes. And personally, I don't want to be in a world, I don't want to live in a way that if I lose someone close to me, I don't grieve. I want to grieve. I want to grieve the loss of that person, and I want to miss them. And that's a way that I sort of cherish them as well, and I continue to cherish them. So I do not want to live personally in a world where we don't struggle, we don't suffer, we don't grieve. And that world to me is a frightening place put out by the pharmaceutical industry, where you're not supposed to struggle and suffer and grieve. And we can see this in the latest DSM. The idea is that if you're still suffering 2 weeks after you lost a close one, that it can be diagnosed as a clinical depression. I mean, think about it. Really, if you're not grieving several months out, that's the problem when you've lost someone close to you. So you're asking, one of the things that we see with our children now is they spend a lot of time on video games in front of the computer. And sometimes those computer games can be remarkably violent with gore, and you're given rewards, I guess, for killing people. I haven't looked up this data, so I'm not really comfortable about talking about it, okay? So what I'm telling you now is not an answer based on a review of the science. It does make sense to me, though, that if you're alone and just interacting with a screen for many hours at a time, that's not nearly as healthy as being outside with a bunch of kids, forming your own games and doing all that socialization and learning how to be with each other. And you're developing social skills, plus you're outdoors, plus it's fun. At some point, being in front of a screen for hours seems lonely to me, and it seems like you're not building these skills. And it does seem something numbing about doing games where you blow people up and stuff. But that's just a guess on my part. It's not anything based in my understanding of any scientific literature.